Here's what I keep hearing in the comments. Can I take HRT with GLPs? These are very smart questions. Often women want to know, can I take a weight loss medication and hormone replacement therapy? Or is hormone replacement therapy for weight loss? So honestly, these are great questions. And I wanted to do top 5 questions about taking a GLP and HRT together. Welcome back to my channel. I'm Dr. Jen, double-boarded OB/GYN and integrative medicine. And like many of you, I'm in perimenopause and I'm always trying to navigate what's the right answer. What are the things that I need to do to stay healthy now and in the future? And this channel is about confidence and clarity in perimenopause, answering all your questions without judgment, and really getting a better sense as to what does your perimenopause journey look like. If you're not even sure you're in perimenopause, check out my quiz, How to Know If You're in Perimenopause and What Are the Next Steps. I guide you through what you should do to take your symptoms and make a symptom tracker and to go to your doctor and ask for the right medications and ask the right questions. It's important that you're your own advocate because many times women are going to their doctor saying, I'm tired, my hair is falling out, I'm cranky, and being dismissed. So coming in with the right tools and the right information and asking the right questions will go so much further. So today let's talk about the questions, the 5 questions that people ask me about HRT and GLPs together. Let's dive in. So first question, can you take GLP medications with HRT? And the answer is yes. Hormone replacement therapy is to replace those hormones that are declining. So estrogen, progesterone, and testosterone. So while replacing estrogen does help with weight loss because estrogen does control hormones like insulin, ghrelin, and leptin. And specifically the GLP medications, Wegovy, Ozempic, Zepbound, Mounjaro, these GLP medications work by helping you lower insulin, meaning that you become more insulin sensitive. And they do that over time. The initial way these GLP medications work is by slowing down the emptying of your stomach, slowing down the bowel so that you actually feel full. And that hormone that's called leptin says, we're full. It's a hormone that's the brain senses. It says we're full. We don't really need to continue to eat. So women on GLP medications notice they don't eat as much. They actually have less sugar cravings because it does affect insulin. And they also notice that they have less food noise. They're not thinking about food as much. And that's related to both GLP hormone in the gut, but also in the brain. And the different medications, you have semaglutide, which is one hormone GLP, and tirzepatide, which is GLP and GIP. They work slightly different, and patients will say they notice differences between food noise between the 2 medications. But because they don't specifically, hormone replacement therapy and GLPs work at the same mechanisms, they can be taken together. And frequently my patients are on microdosing GLPs because they want to lose 15, 20 pounds, and they want to also get their hormones in check. And that takes a while. It takes a good 90 days on hormone replacement therapy to start noticing that stopping of gaining weight and even sometimes losing weight. And so a lot of women will want to do these things simultaneously. And so as long as your medical history isn't a contraindication for taking both medications, which you should talk to your provider about, then you will know that those medications usually can be taken together. Question number 2, will HRT affect how my GLPs work? Will one affect the other? And this is an interesting question actually, because GLP medications, they do lower insulin, right? You become more insulin sensitive than insulin resistant. You notice that honestly, if you start watching your metabolic markers, you notice your hemoglobin A1C goes down. A lot of times people's cholesterol goes down, their triglycerides go down. These metabolic markers do get better on the GLP medications. So could they affect each other? Well, you can imagine that once your hormones are kind of in check and you have estrogen back in the body, then yes, you could be taking less GLP medication because now you have estrogen, which also affects insulin. And so you will not have as much insulin resistance because estradiol or estrogen. I use the term estrogen, and I'm really referring to mostly estradiol, which is the active estrogen. Remember, there are 3 estrogens in the body. So in a way, there are patients who do have HRT. They've been on it for 90 to 120 days, in other words, and they get good results from their hormone replacement therapy, and they're noticing they use less GLP medications because they're able to then regulate their insulin system and control their blood sugars, and often they've lost some weight, and so they could affect in the dosage, and you could be using less GLP medications. I've seen that in my practice quite often, that as women start losing weight and as their hormones start getting in check, and honestly, a lot of times food noise is associated with your hormones being off. So the fact that you crave sugar, or you're eating late at night, or snacking because your hormones are off, you can imagine that once you get those in check, those could actually affect your dosage of a GLP medication. But is there a direct, like the GLP medication will mess up your hormones? No. Okay, hopefully that answers that question. Question number 3. Are there any safety concerns of GLPs and HRT? Well, this question is a little bit more complicated because each of the medications has their own safety risk, right? So if we look at hormone replacement therapy, there are women still at risk for heart disease, stroke, blood clots while taking hormone replacement therapy, especially if they have comorbidities where they have cardiovascular disease to begin with. So there are risks just inherent in the own medications. For GLPs, there's a risk of thyroid cancer. If you have a family history of thyroid cancer, you're not supposed to take a GLP. Risk of slowing of the bowel so much that you get a small bowel obstruction. That's been noted in the literature. There are risks related to your blood sugars getting too low. So there are women who sometimes go below their set weight because they're losing weight. And so you have a risk of essentially a metabolic set point changing. But are there risks associated with both of them together? Not necessarily. So this is where talking to your provider about your individual genetics, medical history, medications is important. Because if you're taking multiple medications that may be metabolized in the liver, for example, this may impact your overall health. But in general, can they be taken together? They're generally safe, both of those medications, to be taken together. Question number 4, what's the best timing and approach? This is my favorite question by far because women will often come to me and say, I'm frustrated, I'm gaining weight, I can't sleep, my libido is tanked, my mood is out of control, I'm angry, all the perimenopause symptoms that you can say, and they want everything done that moment, right? Put me on everything. The issue is that sometimes getting your hormones first done, your hormone replacement therapy dialed in can sometimes stop the gaining of weight. And I've even seen women lose 10 pounds from initially just starting HRT. They never even needed weight loss medications. So I'm a fan of trying to first, we call this stacking, basically trying to get your hormones in check, get on hormone replacement therapy if that's what you're going to do, and dial in your lifestyle changes. Because if you're on a GLP medication and it helps you eat less, but you're eating 3 Oreos instead of 5 Oreos, you're not getting the benefit of the GLP long term. So dialing in both your hormones first, and then second, your lifestyle changes before you start a GLP is important. Now, can you kind of dial in lifestyle changes and GLPs? For sure. I have patients who feel less motivated to eat well, are not really ready for exercise, kind of feel like they're not, don't know the answers yet to what makes sense for them. So sometimes we start GLP medications once their hormones are already in check, because then it's motivating. You start losing a pound or 2 or 3 and you feel motivated to get to the gym. You feel motivated to eat better. And it does help a lot with changing your mindset around what you have to do differently in perimenopause. So there are patients that I will sometimes, after I get their hormone replacement therapy in check, start GLPs and work on nutrition and lifestyle together. GLP medications long-term work much better if you already have a dialed-in nutrition and lifestyle strategy. No doubt. You can look at studies of GLP medications on diabetics, basically, who did not change anything in their lifestyle, just took a GLP medication. And when they stopped, within 1 year, about 80% of those patients had gained the weight back, versus the patients who had actually started making changes in their diet. They started exercising, they started eating more protein, focusing on fiber, doing all the things that we talk about. Though, and especially specifically for diabetics, those patients kept the weight off long term. So no doubt lifestyle is incredibly important. So timing depends on where you are, right? What are you on HRT? Do you need to start HRT first? Have you dialed in your nutrition and lifestyle specifically for your body in perimenopause, and where you need to go for that? So this is a conversation I think that would be best with your provider and looking at your individual needs. Question number 5, cost and insurance. So man, this is probably the most frustrating part about GLP medications and HRT. We still are in an era where women's health is not covered great by insurance. Patients should get HRT covered by insurance. There's no reason it shouldn't be. These medications are old, but as we know, it happens. Like sometimes people have to pay out of pocket for estradiol because their insurance does not cover it. So GLP medications, over the years, they have started to approve less and less. So in 2025, this year, I've noticed that a lot of insurance companies have changed to the GLP medication minimum BMI. Remember, BMI is not a great indicator, but it's what we use in medicine. Has to be 40, used to be 30, now it seems to be 40. You need to at least have a BMI of 30 with comorbidities. So high cholesterol, high blood pressure, diabetes, other comorbidities will often, you have a better chance of getting it covered through your insurance if you have a BMI of 30. But BMI of 40 is what most insurances are now going with. But your insurance is very specific to what they are cover. Some insurances actually have a plan exclusion, which means they will never cover GLPs no matter what. So you need to check with your insurance company to see, is it even possible? Both medications, the semaglutide and tirzepatide, both companies have a patient assistance program. So you can actually go online and find out what that means for you. Those programs are based upon whether or not your insurance will cover some of the cost or none of the cost. So a self-pay versus a patient assistance program. So you can go on both companies' websites and figure out what your options are. Compounding, in my mind, is a great way to get the medication at much lower cost. It also can still be medically managed by your physician, and you can get compounding typically, sometimes it's even as low as $300 a month. It just depends on your location and what is offered in your area. Compounded medications like GLPs exist because people can often not get covered in their insurance and still want the medication, especially if you're microdosing GLP, because there is no microdosing options in the pharmaceutical world. So they don't have options for half the starting dose because that was not why the medication was approved to begin with. So if you're microdosing GLP, you have to use a compounding pharmacy. It's really, really important that you find a quality compounding pharmacy, one that does third-party testing, one that has a sterile facility, one that really is focused on making sure that they deliver a quality, consistent product every single time. So compounding does exist. I use it a lot for patients, and the cost can be much cheaper than using commercial insurance. But make sure that you talk to a provider or do it medically supervised as opposed to just an online program, because you want to make sure that dosing is correct. A lot of times what I find is women go to these online programs and they're given these doses and they go up and up and up and up and up, and they get nauseous and they end up having side effects, and they think it's the medication. And honestly, it was because their person they saw online just told them to go up and never actually checked in with them to see, is this the correct dose? You want to use the lowest dose that you need to use to get the outcome that you want so that you don't have side effects. I know I said 5 questions, but I wanted to address 2 more concerns that I hear come up with patients. One is, am I stuck on these medications forever? And the answer is no. I often have patients who actually get off. And if you're using the FDA-approved medications, it says just stop. If you're going to stop the medication, there's no weaning. I find it actually goes better when women wean off the medication. So they actually will take lower doses, spaced apart, and ultimately get off the medication. So you do not have to be on it lifelong. You can have a goal of, say, losing 15 or 20 pounds, and then ultimately getting off of the medications. And the reason you can get them off is because you've learned a lot more about what are the lifestyle choices that you have to make your weight loss sustainable. And often women who are on hormone replacement therapy can also get their hormones in check, and they notice they don't gain the weight that they were doing when they were not on HRT yet. Another concern I see is what happens if you just stop it cold turkey, either HRT or GLP. And to be honest, you can stop those medications cold turkey. There's no tapering or any of those things. Now, if you're on HRT, you will notice your symptoms will return if they were fixing your symptoms. The GLP medications, what I hear from patients is that when they stop cold turkey, they notice this intense food noise that comes back and start having craving issues. That's why in the compounding, I typically wean women off the medication, and I think it goes better. Is there a clinical trial to prove this? No. I'll tell you the evidence on microdosing is much smaller than the evidence on using the standard FDA doses. But in my clinical experience, that's what I've noticed. Remember, there's no one size fits all for menopause or perimenopause. What works for you or your sister may not work for your friend. It's important to be very personalized approach to menopause care and to finding a provider who gets you, who understands the nuances between perimenopause and menopause, and can make a personalized approach for you. If you like this video, please like and subscribe and share this with your friends. If you're not sure you're in perimenopause, please take my quiz, Are You in Perimenopause? And you can learn about the next steps. If you're interested in more in microdosing GLP, check out this video on microdosing, and it talks specifically about what microdosing is, what is it not, and some suggestions. So until next time, thanks for listening.